Healthcare disparities for the LGBTQ plus community are significant, with barriers ranging from lack of awareness from physicians and fear and stigma faced by patients. These barriers hinder access to essential care. In honor of Pride Month, I have the pleasure to introduce you to Dr. Michael Magro, the president of St. Mary Medical Center and a proud member of the LGBTQ plus community. He will shed light on fostering inclusivity and enhancing understanding within healthcare. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. Hello, Dr. Magro.
Hi, Margie.
More than 1 in 8 LGBTQ plus people live in states that can refuse to treat them for their medical needs. That's alarming. And the U.S. government has conducted research that addresses the challenges these individuals face in accessing healthcare. What are some of the more common issues that aren't being addressed in this patient population?
So first, it's a great question. Unfortunately, I'd say every common health issue at this point can go underdiagnosed or underdiscussed for people from my community, strictly starting from an access perspective. So a lot of folks like myself may feel uncomfortable even searching out, how do I find a physician or a nurse practitioner or an advanced practice provider who is going to take care of me, who's not going to judge me, who is going to create the safe space for me to be able to go get care. So that's step one. So a lot of people in our community, unfortunately, don't even know how to access healthcare. Or when they do access healthcare, something happens, the experience right from the start, whether it's being misgendered or dead named if you are somebody who is trans, or, as you're filling out your paperwork and putting, who your life partner is, and could cause questions or looks. And so that could create an atmosphere where somebody, again, doesn't want to go in and take the next step and talk to a physician. When you're talking to a physician, how are they speaking with you? What kind of safe space are they creating for you? I went to medical school and did my residency at a time where, while we're still fighting the AIDS epidemic, I was seeing a lot of the judgment that would come from people that I worked with on people from my community who were in the hospital with AIDS. And so I think it's a loaded question, because for many folks in the LGBTQ community, they may not be able to get just the basic care of what they need. I worry about certain populations within our community, particularly those who are transgender. I think about somebody who's transmasculine who needs to see an OBGYN because they still have reproductive organs that would require an OBGYN. Think about people who are trans feminine and how are they getting their care. People who, when you talk about vulnerable communities, there's a concept of intersectionality. Okay. And so I always think about, the different intersections in our community and how we had seen, particularly in Philadelphia, a few years ago, a problem in the Philly Black trans community, where many folks were dying. They were either being murdered or they were dying because they couldn't get care. So for me, when I'm thinking about a question, or what are the most common health conditions, it could be something as simple as hypertension or diabetes. Yeah.
Now, this is enlightening. I'm so sorry to hear that in today's day and age that we're still dealing with this. And this must cause an enormous strain on an LGBTQ plus person's mental health. Help us understand what they are experiencing and how that can manifest itself in other ways.
So, some of the ways when you talk about the experience, you're talking about, most people just have to advocate for themselves as a patient. A lot of people in our community have to advocate for themselves as a person. Okay. So when you think about states and, you mentioned about can refuse to treat their medical needs, you talk about states where, there's no protections for employment. There's no protections for marriage. There's no protections for getting a cake for your wedding. I mean, so when you talk about basic rights not being available to some folks, the mental health piece starts with, you know, I am someone, I am of value, and I should be treated and given the same opportunities for things like healthcare or marriage or anything else as somebody else. Um, the other complicating factors are, what is their family life? We talk a lot about having a chosen family because there's many in the community who are not accepted by their blood relatives. You talk about lack of representation on the screen, and while organizations like GLAAD will monitor the representation in media, movies, television, what have you, of folks from the queer community, you don't see yourself, and you don't see your you don't see yourself on the screen, and a lot of times you don't see yourself presented in a positive light in the screen. When I think about, I'm going to be turning 50 this summer, and I think about some of the movies you would watch where people who are trans or queer were treated as people to either be ridiculed or be afraid of, or you think about things like Silence of the Lambs, right? And a lot of times people who are different are painted as monsters or villains, and so that all plays into the mental health. And then you exacerbate any underlying things like depression or bipolar, overlay it on that foundation that unfortunately has been built. Again, a loaded question.
Yeah. Well, thank you for answering that question. What can medical professionals and health systems do to address disparities and foster a culture of inclusivity?
You have to start again right from the access point. So if you at registration, whether it's in an office practice or in the hospital, start with respect for, what are your pronouns? My pronouns are they, them, theirs. How do you allow people to make sure that they're being gendered appropriately, being referred to by name appropriately, being referred to by pronoun appropriately, making sure that there's that welcoming space right from the start. And then in the office setting, making sure your medical assistants, your nursing staff, your medical doctors, your residents are able to create a safe space so that folks from the community can come in and feel comfortable and say, yes, I may outwardly look like a male, but I am gender fluid. And, the reason my eye is kind of messed up right now is because I was wearing mascara this weekend and I fell asleep with it on. So, you can't maybe give the whole picture about what is going on if you can't trust that you can share your story with the person who's taking care of you.
Do you find that this is being implemented in hospitals now and in physicians' office where they ask you your pronouns, where they try to get this information from you? Are you seeing this happening now?
I'm
Are people
seeing it.
starting to do this?
I'm seeing it more often than
But
not.
not in
Although
the
the unfortunate part is you can put processes in with people who don't believe in asking those questions, or the importance of asking those questions, or the importance of creating a safe space. You think about our DE&I events that we have in Trinity Health Mid-Atlantic, where you have a table talking about Pride of Trinity Health, and you have colleagues that come up to the table and say, this is disgusting. So you can have the process in place, but not the appropriate engagement of folks who want to provide that kind of care. And then it leads to a mismatch. And so again, I don't know if I answered your question, but I think some
hopefully
places
we're going to get there.
yeah, some
Hopefully we're going
folks
to get
are a little
there.
bit better at it than others, but
Yeah,
in some
hopefully
health
with
systems.
and more education that we will get there to that point. What advice would you give someone who hasn't prioritized their health due to fear of discrimination or misdiagnosis?
For for our community, there actually are a decent number of resources if you know where to look for them. and if you know how to access them and our ability to access them, particularly when you look at Center City, Philadelphia, where the neighborhood is, right, the Philly neighborhood, you have organizations like William Way Community Center, which they have some recovery programs there. They have some resources there, can at least provide some direction on where people can feel comfortable. Mazzoni Center in Philadelphia is for folks for the LGBTQ community. You can look at, New Hope Celebrates and some other organizations in the greater Philadelphia area and Delaware County area and say, do you know where I can go get care and be treated like a human being?
That's so important. So, Dr. Magro, where do we go from here? I know.
So it's, again, another loaded question, because I think part of it starts with representation, and accountability. And I think there needs to be an accountability from organizations to say, we're going to treat every individual with dignity and respect. Okay. I think that representation matters. It's one of the reasons why I find it very important as the president of St. Mary Medical Center to be out and proud. And that representation allows other folks to be able to see themselves in the organization, themselves in the job role. There's been times when I'm, at a Pride event in Philadelphia and being approached by other community members who may be friends with on Facebook, and they're like, thank you for sharing your story. And I remember how important it was for me before I came out of the closet to see that kind of representation on social media. Social media, there's good and there's bad. One of the good is being able to connect with people who are more like you and who share the same values you do, and that make you feel like you're not alone in the world. So, yeah. So I
relate to that.
So I think, more work in representation, more work in cultural competency. And then ultimately, it's probably the president side of me and physician side. There has to be an accountability. There has to be accountability on organizations, and there has to be an accountability to people. And people have to be told, you will treat folks with dignity and respect.
Absolutely. Thank you so much, Dr. Magro, for being here with us today, for sharing your invaluable insights, your experiences, and for making things better for our LGBTQ plus community. I know with your dedication and, you're out there talking about it, things I'm hopeful will get better for the community.
Thanks, Margie.
Thank you.
Thank you.
If you're a member of the LGBTQ plus community and you have been postponing your medical screenings and health care, please remember your health care is important. More programs are now available designed to give you the proper care and respect that you deserve. Thank you all for joining us for this season of Beyond the Stethoscope. If you have any topics that you would like us to cover in future episodes, please drop us a message below in the comments.